Hello, I'm Dr. Sunil Kutty. I'm a brain and spine surgeon at NewEra Hospitals, Navi Mumbai. Today I'm going to talk to you about headaches and when to worry about the kind of headache that you have and when not to worry about the headache. So headache, if we understand, is one of the most common symptoms that we as neurosurgeons encounter in our daily practice, and it's one of the most common problems that anybody has. It's one of the most common diseases or disorder that a person has. So since 80 to 90% of the people across the globe have headaches at some point in time, it is important for us to recognize the ones which are not the really serious types. It is very important for us to recognize the headaches which are not the really serious types. So those headaches would be the tension headaches, which usually comes as a band across your head, usually accompanied by previous stressors or a stressful phase in life. Then you have migraine, which could be hemicranial, which is usually one side of the head, very severe throbbing headache, usually accompanied by aura. And once these patients start having it, they get an idea about the headache that is impending. So it could be aura in the form of an abnormal smell or some bright lights being seen in front of the eyes. And nowadays, even vestibular headache has been recognized, or vestibular signs in the form of imbalance and vertigo has been accepted as a type of migraine. So these are benign headaches. So the other kind of benign headache could be a screen headache, where working on a computer screen or on a phone for long hours for obvious reasons gives you a headache. So these are the benign kind of headaches, which for which usually we take medication or a change in lifestyle. But then there are these red flags which accompany a few headaches. Now the red flags would be headaches which are persistent, which are continuously increasing. So if the pattern has changed from what it used to be, then it is a red flag. The second red flag would be a severe sudden headache, kind of headache which you've never ever felt in your life. So this could signify an aneurysmal rupture or a subarachnoid bleed. Then headaches which are accompanied by neck rigidity, where you have difficulty in moving your head because of severe pain or stiffness in the neck. That usually indicates something called as meningitis or infection in the meninges or infection in the brain. Now, apart from that, headaches which are accompanied with neurological deficits. If there is weakness in the arm, if there is sudden or even gradual change in behavior, if there is loss of vision or decreasing vision, if there is bowel bladder incontinence. So these are neurological symptoms. So if your headache is accompanied by any of these things, then obviously it has to be taken more seriously and we need to really look at it. So the simple rule would be, if the headache is the worst headache that you've ever had, if it is accompanied by a head injury, if it is accompanied by neck stiffness, and if there is any neurological deficit, then we need to really seek the help of a neurosurgeon or a neurologist and get it investigated. So when it comes to investigations for headache, the most common ones that are sought would be a CT scan or an MRI. So in today's times, where we can actually peer into the brain and see what is happening inside, even if there is the slightest amount of doubt in your head, especially for those above 50, I think it is worthwhile getting an MRI done. In fact, at NewEra Hospital, we have a brain doc program going on, where we do scans for the brain for as little as 2,500 rupees. So it is something which is accessible to anybody. That's something which anybody can spare. And if you are really worried about what's happening inside your head, and if you really want to have a look at what's happening inside, and if there is a reason like a headache accompanying it, you should, I think, take advantage of that and get it sorted. So this was in short about headaches and the headaches which can get worrisome at times. So the simple thing is to get yourself scanned if you have doubt about the type of headache that you're having, and then most of the time the results would come in your favor. If it is not, then we are obviously there to help you out with that. Thank you.